This program is brought to you by Emory University.
So what are we going to do about it as we make progress with detecting it? Our treatments for Alzheimer's disease are pretty crappy right now. We have symptomatic treatments. So we have two classes of drugs, one a class called cholinesterase inhibitors, and another one is memantine, which is a NMDA blocker. These things block acetylcholinesterase and raise levels of a chemical called acetylcholine. And so they're symptomatic, meaning that they don't do anything to change that course that we just talked about. A person who's got Alzheimer's disease who starts these drugs is going to progress at the same rate as somebody who doesn't have the drugs. But it's going to help them functionally and symptomatically along the way. We're also learning that some non-pharmacological ways are probably as effective as our drugs in having an impact, including teaching people how to use their brain in more effective ways for remembering things through cognitive rehab, and physical exercises, I'll show you, also is starting to even show some benefit. This is some work done by some of the faculty here at Emory, so I thought I'd show that, just to give you an example of what cognitive rehab can do. So one of the common symptoms that somebody has with mild cognitive impairment is they go to church once a week and they get there and they realize they can't remember the names of any of their friends. And so that's the problem where they have face-name association memory loss. So it's a very common thing, and what you can do is actually train people how to learn to remember names of faces much better. And so what the investigators here, Ben Hemstead and colleagues, did is they actually trained people with mild cognitive impairment in red so that they were much better, almost 90% accurate, in being able to remember pictures of people they saw compared to people without the training. And these are, what was really important was that it lasted. So even a month after they were trained how to do this, people were getting this incorporated into their daily lives. But what's more interesting to me is that the brain circuitry actually changed. So for very simple techniques, people were actually able to change their brain activity. So doing functional MRI studies in these people showed improved brain activity precisely in the areas of the brain that are early to degenerate in Alzheimer's disease. It's very interesting. The second thing that's been very promising is just physical activity. Talk about low tech. Doesn't cost $10,000 to get a scan. You can do it for free if you run outside. And what this group in Australia did is they took people with mild cognitive impairment and they gave them a 6-month program of activity. And what they were able to show is their cognitive abilities of the people who exercised actually improved, almost to the same degree that these drugs have an improvement on cognitive function. So there's going to be a lot more research in that area of exercise and behavior.
The preceding program is copyrighted by Emory University.